This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for May 6, 2019. Well, it was a busy week in Washington last week as the Congressional Budget Office, which is a nonpartisan analytical agency that helps members of Congress evaluate the financial impact of proposed legislation, issued its analysis of various Medicare-for-all proposals. Now, the CBO is nonpartisan and objective, and so there's, in the analysis, there's very little that is partisan one way or the other. Nevertheless, the response from both sides, conservative and progressive, was almost immediate. The analysis goes into some level of detail, as much as is possible, I guess, talking about the various things that would need to happen in our government in order to be able to accommodate Medicare for All policy initiative. There's still not a whole lot of detail in the CBO analysis because there are a lot of different notions about how to go about doing this. Representative Bernie Sanders was the first one to posit this policy proposal in 2017. He's an independent senator from Vermont and no relation to yours truly, and said, wouldn't it be great if we just took the Social Security Act of 1965 and instead of saying everybody who's eligible for Medicare is 65 and older, that for each year for 4 years, we just change the eligibility age, 55, 45, and so on. Well, that is a very simple legislative idea, but one that comes with a lot of complicated details on how to implement that policy. And the CBO in its report last week really starts to drill down into some of those details. Needless to say, the summary is that the Congressional Budget Office said it's going to be very expensive, probably require tax increases in order for Americans to be able to get the benefit of Medicare regardless of their age. Democrats in Congress and those of the several dozen folks who are running for president or seeking nomination for the Democratic Party in the 2020 presidential election were quick to say that the CBO analysis report shows support for their position on Medicare for All, while fiscal conservatives and Republicans in the House likewise said the CBO just kind of echoes what they've been saying all along. So something for everybody in Washington for the CBO report on Medicare for All. Won't be the last time we've heard about this on the News Nugget, as I'm sure it will be an issue for the presidential election coming up next year. I'm Rich Sanders with Southern Health Lawyers. Thanks so much for watching, and we'll see you again next week. Bye-bye.